All right. Hello and welcome back, everybody. This is Dr. Phil Dieter to welcome you to CalChiro Live today. We've got another special guest for you, and we've got quite a bit of money to potentially give away. Before we get started, I just wanted to make a few announcements. We've got the Women's Masterclass rapidly approaching. There's actually a webinar coming up at the end of the month as well. The masterclass and the webinar are the same thing. That will be coming up. That is actually, man, the topic on that is tremendous. I love learning more about women transitioning to menopause. That's a phase of life that I'm in with my own family members. And this backbone and bedroom title, man, that's going to get some likes and some views, I think. So I think there's something to learn there. Or there's always more to learn when it comes to that. So make sure you're checking in on that if you can join us for that. They also have the Women's Committee also has an upcoming event in January coming up. That's the Women's Retreat. Dr. Barb Eaton is going to be one of the key people there as well. Dr. Anita Hawk, who's part of the committee, is going to be one of the presenters as well. So that looks like it's shaping up to be a really cool event as well. Hopefully you guys can take some time to check that out. I know I'm getting ready to go to strategic planning tomorrow for the association. That's a board event that we do on an annual basis to help steer the direction of the organization. So if people are having ideas in which direction we want to go, what kind of presenters we want, those kind of things, be sure to reach out to me and I'll try to pass it along and communicate what you're looking for. That's one of the biggest things. Hopefully you are taking a look regularly at your weekly adjustment and paying attention to that as far as events in your area. I know we have Sam Collins coming up in our area here in Santa Clara very soon. There's also an event in San Mateo I know coming up. Dr. Makani Liu is going to be presenting on adjusting. So those are some adjusting credits for you. That's being put on by the San Mateo district. I believe that's next week, October 16th. So make sure you're checking your TWA stuff. That's always important. Those are really good ways to connect with other people in your community, and I think that's part of what we try to bring to the state of California is this opportunity to create community, to create connection, to be in the room, to hear information that people don't always get to hear, from the sources and the presenters like we're going to have today. So hopefully you're checking in on that kind of stuff. Otherwise, I want to bring today's guest up for us. Let's see if I can get him up on the screen. Here he is, Dr. Rob Silverman. How you doing, Rob?
I'm doing great, Dr. Phil. How are you today? Love your background, my man.
Thank you, sir. I'm always trying to feel like relaxed, like I'm going on vacation or I'm just chilling. But I wanted to introduce Rob because Rob is he's going to be one of our speakers at the fall conference coming up next year at the Estancia in La Jolla. Rob is a super knowledgeable guy, and he and I have been getting a chance to talk more and more, over the last year or so regarding case management, regarding cold laser therapy, all of that kind of thing. So I think you guys are going to be super impressed by what you hear today. But Rob, why don't you just tell us a little bit about yourself and, how we got here?
Sure. I went to college and I studied accounting. I have congenital torticollis, as everybody can see. And man, that got me at 21 years old. I went to a chiropractor, got worked on. And ever since then, I have not been looking back. It's been a great journey with fabulous destinations. Chiropractic for me has saved my life and it's changed other people's lives that I've touched. So I'm just ready to talk about some things.
Awesome. Well, let's dive into it. I know you've been talking a lot about longevity and how the laser relates to that and that kind of thing and chiropractic's role in that. So why don't you just tell us first and foremost how you really are defining longevity, and we'll kind of go from there.
Yeah, without question. Longevity is the incisive conversation of 2025. It predominates the health airwaves without question. For me, longevity is the definition or the balance between lifespan and health span. How long you live life, how healthy you are without chronic disease, health span. Did you know that the bulk of people in America have some form of chronic disease? 6 out of 10 Americans have one, 4 out of 10 Americans have two. It's been a drain on our healthcare system. 98% of our Medicaid dollars are spent on chronic disease. 86% of our Medicare dollars are spent on chronic disease. So for me, lifespan, health span, it's not just adding years to your life, it's adding life to your years.
Sure. Well, I know that's, I've heard about that in the chiropractic perspective, as long as I've been alive. So can we discuss a little bit about the hallmarks of aging that you're seeing or you're discussing?
Absolutely. You know what? If COVID taught me something, it taught me that half the world's crazy and the other half of the world's crazier. But what it really taught me was that the immune system in most Americans are dysfunctional and imbalanced. Who better than chiropractors to deal with immune system health? And that's what spurred me on to write my book, Immune Reboot, in 2022. So for me, one of the hallmarks of aging is your immune health, your ability to have immune resilience, or immune competence. Inflammation or chronic inflammation, a tremendous conversation. Most of our patients are pre-inflamed. One of my mantras is to manage and modulate inflammation. Again, that really falls under the veil of chiropractic.
Sure.
The microbiome, the gut microbiome, without question. 80% of our immune cells are in our gut. It's where our macro and micronutrients are absorbed. So the microbiome, and something that's really like Darth Vader coming behind the curtain and saying, hello, here I am. It's called dysbiosis. Dysbiosis, the unleveling of good and bad bacteria. Mitochondrial dysfunction, goodness gracious. I mean, you want to talk about laser, you want to talk about longevity, you want to talk about chiropractic, being a triad together. Mitochondrial dysfunction is one of the key components. Unfortunately, the number one complaint that people have going to a doctor is, I'm tired. That's mitochondrial dysfunction. The inability of mitochondria to function well leads us down a path of neurodegenerative disease. Another hallmark of aging is the loss of muscle mass, sarcopenia, the loss of muscle mass and muscle strength. So obviously, muscle mass is a longevity organ. So if you look at some of these hallmarks of aging, you realize it really speaks to the idea of chiropractic, lifestyle, and believe it or not, non-thermal low-level laser therapy.
Well, that's where, I know Erconia is going to be sponsoring you. I'm really grateful to Erconia for bringing you out here and all of that kind of stuff and all they've been doing to support our association and our organization. That's awesome. Well, why do you go to low-level laser as one of your go-to devices? Why do you think that's so important?
Well, for me, low-level laser is divisive now. I believe that it's revolutionized my practice. It's revolutionized the way that I approach patient care. The reason I added the low-level laser comes back again. I had congenital torticollis. In about 10 years into practice, I was starting to break down. My neck was starting to fuse, and chiropractic was offering me a lot of answers, but they weren't able to really adjust my neck anymore. So I needed something extra. I needed a device. And low-level laser, which had an FDA clearance for decreased pain and increased range of motion, working at the cell level, man, that was the answer. So again, I started with it on myself, my friends, my family, my practice, and now I do it and recommend it not only nationwide, but internationally. And the reason is low-level laser allows for mitochondrial dysfunction. It improves mitochondria health. It also has shown through blood tests to decrease inflammation. It does so by increasing interleukin 10, which is an anti-inflammatory interleukin, and conversely decreasing interleukin 1 beta, interleukin 6, interleukin 8. Whew, that sounds great, but the basic premise is it decreases inflammation, proven on blood tests. Its FDA clearance is for decreased pain and increased range of motion. So in a chiropractic veil, what better device to use than a non-thermal low-level laser based on photonic energy?
We had Dr. Dan Murphy at our fall conference, and he was talking a lot about that too. One question I was wanting to ask him, and maybe you can answer this a little bit, is talk to me about the difference between low-level laser and like the class 4 ones that heat up, and some of the differences. When is one indicated versus the other, maybe, and why you choose. Well, you've already told us why you choose low level laser, but
Right.
yeah, that's just something I think a lot of people are still trying to wrap their head around.
It is, and I'm happy that Dr. Murphy was able to speak for you. He is without question an icon in the field of chiropractic. I mean, who's been around longer and produced more quality information and lectures than Dr. Dan Murphy?
Sure.
That aside, non-thermal low-level laser or class 2 has no heat. So
Okay.
again, it works on photonic energy, the ability of the cell to absorb the photon to stimulate and cascade cellular responses. The hot lasers or class 4s you talk about it produce heat. For me personally, I don't find heat an effective means of healing. Every laser has its place. Every device has its place. For me, I found that the non-thermal low-level laser is the gold medal winner. I also think some of the questions that people ask are red light therapy versus non-thermal low-level laser.
For sure.
Red light therapy is an LED. It's a light emitting diode. So again, it just generates heat, but really doesn't have a health promoting effect. So you're really comparing apples to the sky blue. One is FDA cleared, and another one I utilize, with all due respect to everybody out there, I utilize the LEDs to heat my sauna. They have their place, but again, they're not as versatile. They're not FDA cleared. They don't work at a cell level. So now everybody can send me a little hate mail. Go for it.
No hate mail. Like I said, I'm really just trying to understand, trying to help our audience understand, and maybe answer some questions. I always say, if I got questions about it, somebody else has got questions about it. Right?
It is what you asked is the most commonly asked two questions, compare and contrast. Because now we live in a world where who do we trust? What device do we have? There's so many people. We're live. There's podcasts. There's reels. It's great that they're asking chiropractors on treatment modalities and how to get better in health and longevity. So absolutely. I'm stoked that we're having this conversation.
And I think, like I said, Erconi has been such a stalwart innovation for our profession. You really appreciate all their support and want to support them in every way we can as well too. Maybe you could tell me a little bit like how you utilize it in your practice, and because one of the things that always comes up, how do I know it's working, right? Or how do I know it's doing anything? So maybe you could talk about that a little bit for our audience in terms of how you utilize it to show people its efficacy, even pre and post treatment, those kind of things.
Absolutely. I agree with you. I think that realistically, if I could do something for your followers and your viewers, one day I'd like to come back and give you a look inside the office. It just seems to be so much more evocative. Mm-hmm. That said, I started using the FDA cleared Erconi laser for musculoskeletal injuries. Because, as chiropractors, that's what we do. Sure. Rotator cuff, cervical spine, headaches, lower back pain. What do we see more than lower back pain? So I did it in a musculoskeletal light. Then some data came out and some FDA clearances came out on neuropathies, nerve root issues. Again, very chiropractic. Now we're doing it for things that I like to refer to as in the realm of functional medicine, in that I use it for the gut. Vagus nerve stimulation. My goodness. If you want a game changer, get a laser, utilize it for a vagus nerve protocol. Okay. I can tell you that the balance of that parasympathetic nervous system will be a critical add to your overall healthcare needs. In addition, a lot of neurodegenerative diseases, because of the mitochondrial dysfunction, Alzheimer's, Parkinson's, and the like, give you a little bit of an inlay. What I like most about low-level laser is that it's a great standalone device, but it's synergistic that anything you do with chiropractic, your adjustment, your soft tissue, your exercise rehab, your dry needling, your taping, your traction, whatever it is that you do, laser works in synergy with it to get a better clinical outcome.
So talk to me a little bit about some like the objective criteria that you're using before and then pre and post criteria, that you're using in that setting.
That's fabulous. That's a great question. So obviously we do visual analog scales, which are great. We've utilized them greatly. We've measured range of motion. What I do in my office that I find very unique and exciting to share is I blood test people before treatments, and then I go through a treatment protocol and I blood test them after. So for instance, on leaky gut, I've seen a plus 60% decrease with 6 to 8 visits utilizing just the laser for a leaky gut. You add the nutrition, and now you're in 8 out of 10 realm, which is great. And we're talking about candida, elevation of yeast. We're talking about an overexpression of zonulin and occludin, damaging the tight junctions. And maybe the big one, a precipitous decrease in the expression of lipopolysaccharide, LPS. So that said, all those things are going to really lead to health, because I do believe that the gut is the epicenter of your health. As I said before, 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. And as we all know, the number one nervous system is in our gut. It's called the enteric nervous system. That enteric nervous system communicates with that nerve I mentioned before, that vagus nerve. That vagus nerve communicates with the brain. So now we have the microbiota, gut to brain axis. We're functioning well. I like to refer to that as the superhighway to health.
Nice. Yeah, I mean, I'm right there with you. That gut health is so important. I see that in so many cases, like you say, that come in, just everyday cases, But can we jump into some of the biomarkers that you're seeing for like longevity and things of that nature? And then I want you to, talk to us a little bit about the nutritional component. We got about 5 or 6 minutes more here that we can gain some more insight from you. So can we go down that path a little bit?
Absolutely. Those biomarkers, these are not biomarkers just for your patients. How about biomarkers for the chiropractor? Because those who are going to give healthcare need to be healthy. And these are some of the biomarkers that are missed by the chiropractic profession when we work with other practitioners. So write these down. Number one thing you want to test for if you're worried for Alzheimer's, let's go for the number one genetic marker. It's called ApoE. ApoE, you have 3 types of outcomes. You have an ApoE2. Less than 1% of the population has that. If you do, you're never going to see Alzheimer's. Kumbaya. ApoE3, 75% of people have an ApoE3. That said, you're in neutral. If your lifestyle is good and you take care of yourself, that healthy car will move forward without Alzheimer's. However, if your lifestyle and your environment's bad, it goes in reverse and it goes towards Alzheimer's. If you have an ApoE4, if you have 2 of those alleles, you increase your incidence of Alzheimer's, your genetic precipitation towards Alzheimer's by 8 to 10 times. Chris Hemsworth, the guy who plays Thor, that tall, good-looking guy, he has 2 of the ApoE4s. He stopped everything he did to get his life in order, and he was leading a healthy lifestyle. It's a very famous reel in a moment with him and Peter Thiel when it was revealed to him that he had an 80% or more increased chance of getting Alzheimer's. So he needed to be on an anti-Alzheimer's protocol. Who better than chiropractors than to give the nutrition for Alzheimer's, the laser, the chiropractic adjustments, etc. Another big marker would be ApoB. ApoB is the cholesterol marker. ApoB as a cholesterol marker implies a 3 times increased chance of getting a heart attack versus typical heart markers. So under an ApoB would be an Lp(a). Lp(a) is a genetic marker for heart disease. So cholesterol markers, ApoB, Lp(a). Don't tell me HDL. Don't tell me LDL. Don't tell me total cholesterol. Share with me the ApoB, Lp(a), and share with me the LDL particle size. And last but not least, believe it or not, I would definitely look to the idea of testing the gut. And in the gut, I would test for a lipopolysaccharide and the expression of LPS. You do those 3 markers, you're going to put yourself in an understanding of a better health outcome. One more aside, LPS, lipopolysaccharide. Interestingly enough, the expression of that in the blood increases your incidence of cardiovascular disease by 3 times. I know we're getting a little technical problem. I still see that I'm live. So let's talk a little bit about the nutrition. Like you said, some nutrients that lead us, that we as chiropractors can take for longevity. First one out of the block, let's talk about it. The peptide, BPC 157, the Swiss Army knife of health. BPC 157 I like because it provides a swath of health promoting properties. It's been called the Wolverine nutrient. That Wolverine nutrient is essentially because Hugh Jackman, the the actor who played Wolverine gets shot and heals before your eyes. It's that quick. BPC 157 is great for chiropractic patients in that it works with the gut and the gum microbiome. It helps with many different musculoskeletal injuries. Another supplement at the top of everybody's consciousness is creatine. And it's creatine monohydrate, not creatine HCl. Creatine monohydrate is great because it's a mitochondrial effect. It helps with muscle protein synthesis. It helps with muscle energy. It's better for women than men in that it helps with cognitive effect. You do not need, I see you. I'm going to comment on that. It's going to be wild. You do not need to load. You can take 5 to 10 grams a day of creatine, and that should be sufficient. I take it every day. And the third is a combination. It's going to be omega-3 fatty acids, 2 grams. If you take omega-3 fatty acids 2 grams a day, you add 5 years of healthy life to your longevity. 2,000 IUs of vitamin D3 with K2, you add 3 years of life to your healthy longevity. So 5 plus 3, last time I looked, that was 8. And I'll add 2 more years to your lifestyle. If you get 7.5 hours of sleep per night and sleeping on your left side, you just got a decade health-free. And that's before you see the chiropractor. Once you get the chiropractor, the rocket ship goes off. Dr. Phil wants me to comment on methylene blue. He really wants me to get shot.
Yeah, we had a question. We had a question in the chat. I was trying to follow the clip. And by the way, a great job carrying the broadcast as I had that camera difficulty. So kudos to you, sir. But yeah, there was a question in the chat about, can you comment on methylene blue on the effect of mitochondria?
Absolutely. And no problem. I can be slightly loquacious. So I was just getting in my mode when you had a little problem, but we're good. So methylene blue. Yes, methylene blue does help with mitochondrial function. It's not a direct photonic add. It reroutes and adds photons in a reroute position. For me, I don't take methylene blue, which is not going to be very popular. And the reason I don't take it is twofold. Number one, it's a dye. So there are limits to how much you could take. I like to be able to take things every day. And because it's a reroute, and if you look at the complex pathways, complex 1 through 4 in the mitochondria, there's some specific nutrients that fill in those complexes like coenzyme Q10, NAD, FAQH. So because it doesn't, I choose not to use methylene blue. But I'm happy they brought that up because that really speaks volumes to the idea of adding photons to complex 1, complex 2, complex 3, complex 4. And that's why I use the non-thermal low-level laser, because it's a photonic donor, not a rerouter, to stimulate mitochondria optimization and function.
Dude, this is there's so much info here to learn. Like when you come out, I think you're going to blow people's mind in terms of how much info you have to offer and that kind of thing.
It's great.
I wanted to remind everybody about Dr. Rob's book, The Immune Reboot. It's up here on the screen. Do you want to tell us a little bit about how to contact you if anybody has any questions or wants to connect with you at all? What's the best way to do that?
Thank you so much for the platform. Anybody who's interested, you can reach out to me, drrobsilverman.com at my website, or info, better yet, I'll give you my personal email. Here you go. My wife's going to kill me. drrob.silverman@gmail. Come out and reach out. Come follow my podcast, Proven Health Alternatives. Dr. Phil probably wants me to say, why did I write the book Immune Reboot? I kind of alluded to that before. And I'm not pro or anti anything. And I respect all doctors. I thought if there was one thing that went wrong was the explanation of how the immune system works. I thought that the TV docs really were short on that. It burned me up. It burned my rear end. So I wrote a book explaining how the immune system works, how to reboot the immune system, how to deal with long COVID, and quite frankly, how chiropractors make a positive effect on the immune system. No surprise there.
Yeah. Well, amazing, dude. Like I said, I learned so much. I'll have to get that and listen. Can I listen to it, or is it a audio book as well?
It is not an audio book, and the joke was they just didn't want another guy in the news with a New York accent.
All right. Fair enough. Fair enough. Well, thanks so much for being on here today. Thanks again to Arconia for sponsoring your talks in the future. But we got to try to give away some money today. So hopefully you can hang tight with us while we try to do the wheel, and we'll go from there. Okay.
Love it.
Well, let's bring up the wheel. I'm not even sure how much money we have to give away today. I know it's a lot. I got the Chiropug here to help me. I believe we have $900. I'm being told 900. So that means 9 names today. Let's see if we can give away some money. Let's do name number 1. Eric Moonbauer. Eric Moonbauer, you are name number 1. We are hopefully going to give away some money today, but $900, that's some healthy cheddar right there. That's almost a whole rack when you go to Vegas. If we can give away a whole rack before we go away to for the strategic planning, I'll be stoked. But yeah, Rob, like I said, I really appreciate it, man. You know, you've been so helpful to me individually in my own practice when I've had questions about lasers and things like that. So if you guys have questions, I know Dr. Silverman will be so gracious with his time. That's one of those things that I can't speak highly enough about. So even doing this has been great. So I'm glad we're getting a chance to interact more. I don't see Eric with us today, so let's move on to name number 2. Name number 2. Valerie Moreno. You are name number 2. You know, we've got more and more people now in the digital canasta here, the digital wheel, and so the chances are going, I guess, down if we're spinning more names, but we're getting more members, which is really what we're trying to do, you know, for any organization. So, but it's good to see some new different names on there as well, too. I know everybody was questioning the validity of the digital spinning wheel. So that was name number 2. I don't see Valerie in the chat. We'll wait just a few more seconds. I know the chat's always a little bit delayed here from what we're doing live, but I don't see Valerie. So let's move on to name number 3. James Craig. I feel a little bit like we're like in the casino almost, you know, spinning the roulette wheel when we do this kind of thing. That was name number 3, James Craig. Let's see if James is with us. But yeah, like I said, super cool to have you on the program again and learn even more. That whole mitochondria thing, it's just, this is what I really need to know from you. I need a way. I want to be able to show patients. Maybe we could talk about this at the convention too. You know, how do they see that immediate effect from a 5 to 10 visit treatment protocol, right? That's the thing always in trying to bring more value to the table for patients with the class 2 lasers is how do I show them that benefit on the cellular level, right? That's always the thing that I struggle with personally in using the laser. So, all right, that was name number 3, but let's do name number 4. Name number 4. Jalvin Sato. Jalvin Sato, you are name number 4. Let's see if Jalvin is here. Now that I am thinking about it, if you are into the animal chiropractic arena, or if you're in the animal chiropractic arena, we've got a lot of things going on. Make sure you are connecting with Marissa Palmer regarding all the things that are happening on the animal chiropractic front. It's go time, folks. This is where we need political action committee dollars. This is where we need your advocacy. All those things are going to be super important here in the next few months and leading into next year to really try to establish animal chiropractic as a separate and distinct entity here in California. So if you know some animal chiropractors out there, tell them, you know, it's time to giddy up. So let's go. All right. I don't see Jalvin in the chat. Let's do name number 5. Let's do name number 5. Nicholas Chauquet, you are name number 5. I got a question here, Rob. What lab company do you recommend for Alzheimer's testing?
Believe it or not, LabCorp does it. They have a what they call an ATN, which A stands for amyloid, T stands for tau tangles, N stands for neurofilament light. It's $449. If you're looking for ApoE, you can get that from LabCorp. ApoE is about a $75 test.
Okay, thank you so much, man. That's super helpful. And if you need a LabCorp, I mean, it's easy to set up a LabCorp account. Anytime you can just contact LabCorp, they'll set you up. So,
yeah.
All right, that was name number 5. Let's do name number 6. Peter Real. I know Peter. I just saw my dad's name go by there too. He almost won the money. And he was just in my office like 15 minutes ago chatting me up. I told him to make sure he watches the broadcast today. So hopefully he's watching. Maybe he can win some money today. I'll make him donate it back to the PAC or something like that. But I also saw somebody in the chat there asking, how do they get in touch with Melissa? It's actually Marissa, Marissa. Marissa is right here in the chat with us too. So maybe she can put her information, or she can message the Lumberyard, Sharon Bruce, about all the things animal chiropractic. So that was name number 6. All of my Santa Clara folks will have to let Peter know that he won the money but wasn't here to collect. Let's do name number 7. Erica Robinson, you are name number 7. Let's see if Erica's here to collect the money. Another quick note, right now is super important time. If you're an ACA member, if you see Medicare patients, we need to get legislators in California on board with the Medicare Modernization Act. I just secured Jimmy Panetta as a sponsor for HR 569. That's the Medicare Modernization Act. I really encourage you to download and print their materials, hand them to your patients. It's a quick scan of a QR code to send the email. We need to be bombarding these folks with emails and texts and things like that to get enough sponsors so that this thing can get voted on. So highly encourage you to do that. If you haven't done that yet, please, or reach out to me and I'll walk you through it. I can hold your hand. So, all right, I don't see Erica. Let's do name number 8. Christopher Seeley, you are name number 8. Let's see if Christopher's here in the chat. I know the ACA has also got their Engage event coming up at the end of January. Unfortunately, I have a conflict now that I can't attend the ACA Engage. I'm super bummed. I was looking forward to that. But, you know, it goes to show you the real work is done at the home office. So let's do the grassroots work that needs to be done to secure the member sponsors, you know, so that this thing can come to a vote. And it's as simple as going to the acatoday.org, downloading the materials, handing them to your patients, getting those emails out yourself. So Christopher Seeley, I don't see Christopher Seeley here today, which means we are on name number 9. Name number 9, hopefully. Jennifer Buchanan, you are name number 9. Let's see if Jennifer's with us here today. If there's no Jennifer Buchanan, that means $1,000. $1,000. That's a whole rack when you go to Vegas right there. $1,000 next week if no Jennifer. But thanks again, Rob, for being on the broadcast with us. I really appreciate it. You're super knowledgeable, man, and down to earth, and just so gracious with your time, your talent, and all of that kind of stuff. So really appreciate it. Here's the QR code one more time for Dr. Rob's book. I know people were scanning the QR code already. I see that up in the top. And if you have other questions, I'm sure that you can reach out to Rob. He's been so gracious with me and his time. But thanks again. Thanks, everybody, for being on the broadcast. I don't see Jennifer. So next week, $1,000. I think we're going to have a guest host next week because I'm going to a political fundraiser, which means maybe we'll get Dr. Rob Shapiro back on here, or maybe Dr. Meg Spicer can sub in. I know there's a good guest next week as well. But thanks again, everybody, and we will see you. Take care.